Genius Solutions Medicare Merit-Based Incentive Payment System for 2017. This webinar will go over the following topics. What is the Merit-Based Incentive Payment System, or what is MIPS? Eligibility and qualifications. Pick your pace. A program breakdown that goes over quality, improvement activities, and advancing care information, and then additional resources. So what is the Merit-Based Incentive Payment System? It's a new program that replaces meaningful use, the physician quality reporting system, and the value-based payment modifier, and merges them into one program. They've also introduced a new category to this program called improvement activities. The combined score of all four categories will be compared to a threshold to determine a provider's payment adjustment. Reporting data for 2017 will affect your 2019 Medicare Part B payments. Positive or negative payment adjustments start at 4% in 2019 and gradually increase to 9% in 2022. This program is only for Medicare EHR incentive participants. If you are a provider that has applied for the Medicaid EHR incentive program, meaningful use is still applicable to you. The following clinicians are eligible to participate in the MIPS program: medical doctors, doctors of osteopathy, chiropractors, podiatrists, dentists, optometrists, physician assistants, nurse practitioners, clinical nurse specialists, and certified registered nurse anesthetists. If you are a provider that participates in an advanced alternative payment model and meet the payment or patient requirements, then you are exempt from participating in MIPS. Alternative payment models include comprehensive ESRD care, two-sided risk, comprehensive primary care plus, next generation ACO model, shared savings program track 2, shared savings program track 3, oncology care model, two-sided risk, comprehensive care for joint replacement payment model, and the Vermont Medicare ACO initiative. If this is your first year accepting Medicare Part B payments, then you are exempt from participating in MIPS. However, in subsequent years, you will be eligible to participate. If your Medicare billing charges are less than or equal to $30,000 and you provide care for 100 or fewer Medicare patients in 1 year, then you are exempt from participating in MIPS. Please note, most providers will be participating in this program. In 2017 only, there are different options a provider can take. If you do not participate in the program, meaning if you do not submit any type of data, you will receive a negative 4% payment adjustment. If you submit test data, that is either one quality measure, one improvement activity, or the required amount of advancing care information measures, you will avoid the payment adjustment. If you submit data for 90 days, you may receive a neutral payment adjustment or a positive payment adjustment. If you submit data for a full year, starting January 1st, 2017, you may earn a positive payment adjustment. Remember, the payment adjustment depends on how much data you submit and your composite performance results. To receive any type of positive payment adjustment, a provider must start reporting data by October 2nd, 2017. The payment adjustment is based on your performance rates in the following categories: quality, cost, improvement activities, and advancing care information. In 2017, combining the performance score from quality, improvement activity, and advanced care information categories will provide a composite performance score. Cost is not calculated into the score for 2017. We will go over each category, how it affects the composite score, what is required to get an upwards payment adjustment, and how to report each category. Quality. This replaced the Physician Quality Reporting System, or PQRS. This makes up 60% of your composite score. You need to report up to 6 quality measures, including an outcome measure that is applicable to the clinician's service for a minimum of 90 days. If an outcome measure is not available that is applicable to your specialty or practice, you can choose another high priority measure. If you are planning on using ehrTHOMAS for your quality category, you must select at least 6 measures, with 1 being an outcome measure, out of the 13 certified quality measures. A QCDA report must be generated from ehrTHOMAS and submitted through the QualityNet portal. The following measures are certified in ehrTHOMAS. CMS 69, Preventative Care and Screening, Body Mass Index, Screening and Follow-up. CMS 117, Childhood Immunization Status. CMS 122, Diabetes Hemoglobin A1C Poor Control. CMS 123, Diabetes Foot Exam. CMS 125, Breast Cancer Screening. CMS 127, Ammonia Vaccination Status for Older Adults. CMS 130, Colorectal Cancer Screening. CMS 138, Preventative Care and Screening Measure Pair, Tobacco Use Assessment and Tobacco Cessation. CMS 139, Screening for Future Fall Risk. CMS 147, Preventative Care and Screening, Influenza Immunization for Patients 6 months and older. CMS 155, Weight Assessment and Counseling for Children and Adolescents. CMS 156, Use of High-Risk Medication in the Elderly. And CMS 165, Controlling High Blood Pressure. CMS 122 and CMS 165 are outcome measures. There are 2 quality measures that are certified in ehrTHOMAS but cannot be used for MIPS. They are CMS 163, Diabetes Low-Density Lipoprotein Management, and CMS 182, Ischemic Vascular Disease, Complete Lipid Panel, and LDL Control. Please refer to How to Meet Quality Measures in ehrTHOMAS video for additional assistance. To review the certified measures inside of ehrTHOMAS, click on Reports, then click on System Measures. On the left tab, click on Clinical Quality Measures, and here you'll be able to see all of our certified measures. There are other ways to report the quality category if you cannot select 6 from the previous list: through your claims, a QCDR, or a qualified registry. Genius Solutions recommends visiting the Quality Payment Program website to review all measures and how to report them. Cost. This measure is based on your claims and availability of sufficient volume. The cost calculation will not be used to determine your payment adjustment in 2017. However, in 2018, it will be used. Clinicians do not need to report anything. The government will automatically calculate this. Improvement activities. This is the new category. It makes up 15% of your composite score. And in order to get an upwards payment adjustment, providers must choose one of the following combinations for a minimum of 90 days. 2 high-weighted activities, 1 high-weighted activity, and 2 medium-weighted activities, or at least 4 medium-weighted activities. There are 92 measures that you can select from. On the Quality Payment Program website, click on Explore Measures, then click on Improvement Activities. This area will provide you with all 92 activities that a provider can select from. Some of the improvement activities cannot be maintained through ehrTHOMAS. Therefore, Genius Solutions recommends, in case of an audit, to maintain records outside of your EHR to provide evidence that you've completed an improvement activity. All of this information can be reported through an attestation, a QCDR, or a qualified registry. Advancing care information. This replaces meaningful use, and it makes up 25% of your composite score. Report up to 4 or 5 required measures for a minimum of 90 days to receive credit for this category. To receive additional credit, you can report up to 9 measures for a minimum of 90 days. There are no thresholds that the provider has to meet. All measures are performance-based, so the more measures you report on, the better your score will be. There are 2 options on what type of data you could submit based on your EHR edition. Advancing Care Information Objectives and Measures uses 2015 edition of an EHR. 2017 Advancing Care Information Transition Objective and Measures uses 2014 edition of the EHR. ehrTHOMAS is certified for 2014 edition. The rest of the Advancing Care Information material will focus on the 2017 Advancing Care Information Transition Objectives and Measures. To get an upwards payment adjustment, you must report on all the required measures for a minimum of 90 days. This includes a security risk analysis, e-prescribing, provide patient access, and health information exchange. For additional credit, you can submit up to 9 measures for a minimum of 90 days. Additional measures include view, download, or transmit, patient-specific education, secure messaging, medication reconciliation, and immunization registry reporting. For bonus credit, report public health and clinical data registry reporting measures. This includes syndromic surveillance, specialized registry, public health registry, electronic case, and clinical data registry reporting. You can also use certified EHR technology to complete certain improvement activities. Please refer to How to Meet Advanced Care Information Measures in ehrTHOMAS video for more assistance. Advancing care information data is reported through an attestation. Please review the following websites for additional help: the Quality Payment Program website for information regarding the MIPS program, Centers for Medicare and Medicaid Services for the latest industry news, Genius Solutions website for product information and services, and the Genius Solutions YouTube page for educational videos about our software products. This concludes our video on MIPS. If you have any additional questions, feel free to give our support team a call at 586-751-9080, Monday through Friday from 8 a.m. to 6 p.m. Eastern Standard Time. Thank you so much for watching.